Today we're going to do a little bit with the BPPV testing. This is to identify the type of BPPV and its location. We're going to do a Dix-Hallpike maneuver. This has been established probably since the early 1950s, and it's still used today. The Dix-Hallpike maneuver is going to be utilized to really determine and to test the anterior canal of the semilunar canal and the posterior semilunar canals. The patient is placed in long sitting. You ask the patient to cross their arms. From this position, I'm going to cradle behind the mastoid process. I'm going to move her head into a 45-degree rotation, slight extension, so it's about 30 degrees. In the count of 3, we're going to bring the patient down rapidly into supine. From this position, I'm going to ask the patient to keep her eyes open so that I can observe if there's any nystagmus and which direction that the nystagmus would go in. If the nystagmus or the eye movement goes into an upbeating pattern, that would be indicative of a posterior canalithiasis. If it's a downbeating, it would be more indicative of something that's taking place in the anterior canal of the semilunar canal. So we're going to give it a shot. A little long-winded. All right. Ready? 1, 2, 3. So I'm observing for the nystagmus and the movement of the eye. Ask the patient to keep her eyes open. I'm going to hold it here for just a little bit under a minute, because if it's a canalithiasis, the nystagmus could take place after about 30 seconds or so, and there's a delay or latency. If it's a cupulolithiasis, it would happen immediately. In this position, I'm going to help bring her up. The Dix-Hallpike maneuver, I'd also use it the other direction and apply the same procedure.